Thank you, Mr. Chairman and Ranking Member Murray. The FDA makes sure that devices we use and that drugs we take are safe and effective. The FDA makes sure that our blood supply is secure. The FDA makes sure that our food is safe to eat. The FDA makes sure that nutrition labels are accurate. In these and many, many other areas, the FDA is the cop on the beat, getting innovative and important products to market and at the same time trying to keep Americans safe. So I don't understand why one of the first things that President Trump did when he took office was to start cutting the number of people at the FDA. And a few weeks ago, I asked FDA officials about the federal hiring freeze that the president has imposed on the agency. Those witnesses indicated that while some FDA positions had been granted exemptions, others had not. Ms. Holcomb, am I correct that the proposed prescription drug user fee arrangement funds about 230 new positions at FDA?
Yes, Senator.
Thank you.
230 new positions over the course of the 5 years of PDUFA 6.
And why does the FDA need those new positions?
To carry out the goals of PDUFA 6 and to continue to meet all of these goals that have been in place for almost 25 years to enhance drug development and to be sure that the review is efficient.
So this is about expediting the review
Yes.
of drugs, basically.
Yes.
Does it worry you that at the same time that we're trying to boost the number of staff implementing the FDA's mission, that the president is trying to cut the number of FDA staff by preventing the agency from filling vacant positions and by enacting mid-year cuts?
It worries me that a hiring freeze would prevent FDA from filling vacancies and hiring new positions that we believe, through our negotiations and our understanding of how many people it takes to change a light bulb, are needed to achieve the goals of PDUFA 6. I think it may be not 100% recognized that PDUFA fees pay for the staff who work on PDUFA activities.
Right.
But so this is money that fee payers are paying into the agency. That money is paid in those fees by statute. So it's not like, well, we're not going to collect them anymore. Right. We have to pay the fees. The fees are for hiring people. If people can't be hired, the fees can't be spent. That's not a good thing for anyone.
All right, but for very specific purposes, and that's why it is that I'm concerned about this. In addition to the hiring freeze, President Trump's budget blueprint calls for cutting congressional support by as much as $1 billion for the FDA next year. And now President Trump says he wants to cut $40 million from the FDA's budget in the current year, which has only 5 months left in it. Ms. Benz, when drug and device companies negotiate user fee agreements with the FDA, they get to pick and choose what gets funded. Is that right?
That's correct.
Yeah, so for instance, if they don't want to fund post-market surveillance programs to track how devices are performing once they've been implanted in patients, they can just refuse to let their fees go toward those activities. Is that right?
For the purposes of the establishment of the NEST for post-market activities, that would be funded out of appropriations.
Okay, and so if appropriations is cut, then there's less money for that. And what about the FDA's public health work on issues like tobacco use or food safety or keeping the blood supply safe? Do the medical product user fee agreements fund that?
Largely, they don't. Actually, budget authority appropriations still fund about 30% of the medical device review activities at the FDA and almost 50% of what's done for devices. So a lot of the activities that fall outside of the agreements would have to be sacrificed.
Okay. President Trump seems to think that user fees are a substitute for Congress doing its job. He's wrong on this. They are a supplement, not a replacement. And if we take away FDA funding, the result will be a crippled agency, a COP that is severely underfunded and whose ability to enforce the law will be at the mercy of whatever the regulated companies do or don't want to see enforced. I think that's a recipe for disaster. The FDA needs the employees, and it needs the resources to be able to do its job. Thank you, Mr. Chairman.